Okay, I'm here with Jeanette Waite, Practice Development Facilitator at Later Life and Dementia Care at Sussex Partnership NHS Foundation Trust. So I can just ask you, what one action can people working in health and social care take to ensure people with dementia, their relatives and carers, given the opportunity to express their views about care and the support they receive?
I think it's really important to know who the person was before they were diagnosed with dementia, so that you understand that they have a persona that's beyond dementia, so that you can understand who they are and why they might be doing things, why they might be saying things. I think that's a really, really important aspect, and I think that's something that needs to be taken away, just to remember that they are a person with dementia and not just a dementia.
So it's a case of going past the diagnosis and remembering who they are.
Definitely remembering who they are and who they were to other people as well. I think that's really important.
This is where things like memory boxes come in.
Memory boxes, memory books, anything to do with just sharing their story in a way that they're comfortable and happy to do. Like I said when I did my presentation, we all have stories. Stories are what we do and how we tell people about ourselves and where we've been and what we've said and what we've done. So I think if you haven't got that ability anymore, then maybe just to share that story in retrospect is really important.
I'm now here with Philip Warford, Managing Director of Renaissance Legal. So just to start off with, if someone has limited funds, what can they do to ensure their end-of-life care wishes are known and will be taken into consideration when decisions are made?
Okay, I think with limited funds, and as long as the capacity is not a question, they've really got options to do the advanced care plan, look at advanced decisions, and deal with a lasting power of attorney, because all of those things can be free. The forms are downloadable off the internet. There are things that people can do themselves. If they want to take legal advice and maybe have some extra kind of information added in there, then obviously there's going to be a charge, but there's actually no charge for doing those documents. There is a charge for registering a lasting power of attorney, which is £130. That's waived for some people who are on means tested benefits, but largely they still have the scope to do everything themselves if they want to.
And what one action can people working in health and social care take to encourage people with dementia, their relatives and carers to make plans for future care?
Okay, I think that's easy. It's probably one word answer. It's communication. It's all down to communication. If the people communicate early enough, get professionals involved, it's going to get everything absolutely spot on for the person who's suffering from dementia.
Okay, I'm here with Jane Markison, Clinical Project Coordinator at St Michael's Hospice in St Leonards-on-Sea. Just first up, can I ask you, what do you think is the biggest obstacle to people talking about how they would like to be cared for before they die?
Well, I think from my experience that it's mostly that people just don't want to talk about it, thinking that if they talk about it, it makes it real and it hastens the process. So I think that's where a lot of the reluctance comes in.
And what one action can people working in health and social care take to encourage people with dementia, their relatives and carers to have a conversation and talk about their future plans?
Well, I think as they've been mentioning all day at this conference is to normalize the talk about death and dying. As it's kind of commonly known, is that death is the only for sure thing in life. And so if you kind of gently bring up the subject and talk about it as, you plan for lots of things. You plan for your future, you plan for your education, you might plan for a baby. You need to plan for your end of life too. It's just part of that life journey and that planning process. And it just makes good sense and it just relieves anxiety and pressure. So I think that is really important to normalize it and say it's not something to be scary. It's something that is just part of living your life out well and having a good plan.
So it's taking that fear factor out?
It is yes, absolutely. I think we're, I had an aunt who always just whispered the word death. And I think, for her it was very real that said if I said the word out loud, it's going to make it happen for someone. So I do think that it's the more that, it's like anything, the more that we talk about cancer, the less scary it gets for people. And the more that we talk about death as a normal part of life, and it isn't going to hasten it by talking about it, that it will take some of that fear away.
Okay, I'm here with Sasha Ahmed from the Carer Support Service. Can you just tell me a little bit about what you guys do and your role in helping carers?
I work for Care Support Services, and we've just taken over. We are serving people all the way in West Sussex. We are looking after people who've got who've been caring for people something with dementia, who's got dementia or who's got learning disabilities and all sorts of things, and all different various carers come to us and we support them in different ways. We have got some short-term funding for them as well, so if they would like to take a break, we support them on that. So we talk to carers and see what are the things that will make their life better. We recently worked on a project which was personal health budget, and we were looking after dementia carers. And it's a very hard journey, because when they start, they're just given the diagnosis, and we did not have all the memory assessment and everything. I'm talking about, we started in 2009, and it's in 2012 we had the memory assessment and everything. So we went through all the journey. So we talked about what are the started with simple basic things. What are the things if we could put in place? So one of the carers said she would like to have a cleaner, so it will give her more time to look after her loved one. So we did that, and then we arranged some trips for them as well, so that it will give them some time. Then we try and provide respite for them as well, so we will link them up with Crossroads or Regal Care and all of that. So telling them where the things are rather than just signposting. My role was to work with them and find all the pathways which will make their life easier. Yeah. So putting all those things and talking about end of life care, then we had wills and lasting power of attorney. So one of my carers, now her husband is in a care home. But she's been through all of that, through various trainings and everything. So by the time he went into the care home, she was all ready and aware. So I think it was a very successful project that we worked on. And at the moment, we are supporting her still as a carer, even though husband's in the care home, through the Dementia Wellbeing Project, where again we've got some sort of funding that we could give them a time. They could go to a gym or maybe watch a film or something, just a little break from all the worries, which has improved their life. And she was one of the carers who kept her husband very long at home, which saved NHS a significant amount of money.
A lot of these things, it is just sometimes relatively small little things can make a big difference to carers.
Yes. For them it's mostly that there's somebody to talk to them, somebody to listen to them, and they've found it really, really supportive. And if they've got somebody, a clinical person or somebody coming there, they have got somebody like us, because I'm a support worker, just to be with them is just reassuring that what they're saying, there's two people to understand, and then we can go through it, and whatever the best way, then we take that path.
Right. I'm now here with Sylvia Wright, who is a family carer. And what one change would you like to people working in health and social care to make to improve the care and support they give to people with dementia, their relatives and carers?
Specifically for carers, when you're given that diagnosis of dementia, you really need to be given some information about it. Something clear, perhaps from the Alzheimer's Society, but something that's easy to understand, that you can discuss when you get home, and particularly that has some names and contact references on it, because you just go home and you don't know where to begin. It would be a good starting point.
Yeah. So that really is the key, is getting more information to people.
Yes, and in a simple form, because it's quite bewildering, and if you just go online, if you're one of the 50% or whatever of older people who go online, if you do, you can be overwhelmed with information, and all you need is some easily understood information to begin to make some decisions.
And of course, with the internet, there's a whole wealth of information. You just want simple to understand, clear information, and that signposts you to the next steps.
Yes, with some contact numbers. Yes, that's it.
I'm here now with Min Stackpole, the nurse researcher at St Christopher's Hospice in London. Now, just say, first question, what do you think is the greatest challenge in providing compassionate and culturally sensitive end-of-life care for people with dementia?
I guess the real challenge always is to try to provide the care that the person themselves would want. And it's extremely difficult when people are not able to tell you. Incredibly important to ask them when they are able to tell you, and terribly important to involve their families in helping to create the kind of care that that person would want, because you can't make assumptions. And I think, compassion from professionals, from care staff, is probably the absolute core of what is needed, but they must use that to engage with people and their families to give the care that that particular person needs, wants. Yeah.
And what would you say is one action that people working in health and social care can do to make a difference to end of life and dementia care for people with dementia, their family and carers?
Okay, well, I'm a palliative care nurse by background, but I don't think you need to be involved in palliative care to recognise that pain is a very important, is central to anybody's ability to enjoy life. They must be comfortable and pain-free. When people with dementia have pain, I think that can really fill their lives, because they don't really see it as something that can be dealt with, or the past and the future are very blurred perhaps, and the painful present is very difficult to deal with. Pain is underreported, under-recognised in people with dementia. I think that if all professionals at every level, from carer to consultant, were trained and using observational pain assessment tools, and then there was commitment to actually dealing with the problems that were uncovered, that would make an enormous difference to dementia care overnight.
Okay, I'm here now with Norma Pryor, a family carer. And Norma, what one change would you like for people working in health and social care to make to improve the care and support they give to people with dementia, their family and carers?
I would like much closer communication, much tighter communication between all areas at all levels, with each other and also with the family of the person and the person themselves. And I also think they should not just assume because the person cannot communicate that they don't understand and they don't have a certain rate of intelligence. So I also think that it is terribly important that they don't work in separate little cubicles, keeping the information to themselves, and also it must be communication with the person and knowing they cannot go in to look after somebody or help support unless they know the story and they know about the person and the family and the relationships.
So it's about getting to know people, getting to know who they are, who they were and who they still are.
You must never forget the person. You must know the person. Until you know the person, you cannot help or support them.
And involving carers is also important in that.
Sorry?
Involving carers is also important.
Very important, because in the long run they are the ones who are building up the experience, and also they are the ones who know the most about the person you're looking after.
Okay, I'm now here with Lisa Rodrigues, CBA, Chief Executive of Sussex Partnership NHS Foundation Trust. Now, firstly, what do you believe is the greatest challenge facing Sussex health and social care organisations in relation to end-of-life and dementia care?
What's the greatest challenge? Well, I think it is about putting people first, and that's probably going to be the answer to all the questions you asked me this afternoon. It's about putting the human first rather than thinking about systems and processes. If you think about when I started nursing 40 years ago, which is when many of our systems were designed for, people lived till they were about 75. They died of cancer, they died of heart disease, they died of strokes. Now people live from all of those conditions, so we've got much, much older people with complex problems. And what we need to do is design our services so that we meet the needs of that much more elderly population, and I don't think we've done that so far.
Okay, and what's one action that organisations can do to meet those challenges?
I go back to my point about putting people first. We all die of something. Death is not a disaster. Death is a certainty. So in order to make sure that people have a good death, we need to put people at the centre of our thinking, and rather than planning the service and putting the person into the service, think about what would you want, what would I want, what would a member of our family want.
So it's very much going for the personalised service built around the individual.
Absolutely, and planning the service to meet the needs of people who've got complex conditions, rather than providing services that are based on people coming into hospital for a specific problem, which they have an operation and then they get better from. That's not the majority of the people that we're treating these days.
Yeah, so people have more complex conditions, and it's really making sure that they have the best care and best treatment and best life possible.
Absolutely. It's putting that person in the middle, it's talking to their family, and it's making sure that the care is what you would want or what I would want in those circumstances. It's also about having the conversations with people early on in their life so that we know what it is they want at the end of their life, rather than waiting till the last minute and then it's too difficult to have those conversations.
Yeah. So it's getting the plans in place first and then executing them.
Absolutely.
Okay, I'm now here with Catherine Smith from the Princess Royal Hospital. Now, Catherine, can you just tell me what is one action that people working in acute hospital settings can take to improve the quality of care and experiences for people with dementia, their family, and carers?
People need to see the person. They need to not see the person as just a diagnosis of dementia and their neurological impairment. They need to see that person as the whole person that they are, and that they are useful to society, they've contributed to society, and acknowledge their family and carers. They need to get to know that person so that they can care for them and meet their individual needs.
So it's about taking time with people, finding out about who they are and what they like.
Knowing somebody's life history is key to caring for a person with dementia, and remembering that people with dementia rely less on knowing the specific details of events. They rely on their feelings and your feelings and how you approach that person. If you're stressed when you approach that person and you're displaying negative body language, that person with dementia isn't going to respond to you as well as you come across as calm and welcoming, because what we need to remember is that the acute hospital for us is a place of work, but for any patient, and particularly a patient with dementia, it's a scary, disorientating place. You don't feel well, you don't know the environment, and you don't know the people that are caring for you. So a little act of kindness goes a long way.
Right, so I'm now here with Eleanor Langridge, the project manager of the End of Life Care in Dementia NHS Sussex. So just for you, what have been the sort of key points from the day for you?
I think a couple of things really. The importance of this journey starting much, much earlier than people would necessarily do that. At the moment, research tells us that conversations about what people want at the end of their life happen on average about 33 days before they die. For someone with dementia, that is so way too late. So it's been a fairly consistent message through the day that we need to be tackling this much earlier, because if we're wanting people to live well, we need to allay their anxieties much, much earlier. And the best time is to, when we've delivered bad news, is to give them a ray of hope. And that's about, there are ways in which you can actually have some say about what you want to do in the future. I think the other thing is that there's an awful lot of passion behind dementia care that is driving that forward. There's a lot of people working very hard behind the scenes, and change is happening, but it feels like it's at the beginning of the wave and we're nowhere near the crest and getting to the point where it's actually going to tip over and make people feel that there's quite a different view about dementia. And that seems to be quite a thing as well, that people are saying there's still such a lot of misunderstanding about dementia until we get that swell. So we've had speakers who've talked about how we raise awareness, and there's been a very consistent message through about how we do that, and how we've all got a personal responsibility to dispel those myths and to look at things in a very positive way that perhaps we don't at the moment. So whether it's on a professional level or on a personal level, there's a real sense that it is everybody's business. It's not just the health professionals, it's not just the researchers, it's actually the man out in the street, it's the shopkeeper, it's the son, the daughter, the grandchild, and that's been really positive. I think also through the day we've also talked about some very, very, very positive things that people would think, and I think our speakers who have dementia and who are relatives of people with dementia, very powerful in what they were saying, and reinforcing those ideas that actually it is possible to live well. And that seems like a very odd concept for lots of people who shy away from getting a diagnosis because they think there's nothing we can do about it. Well, actually there's lots we can do about it. So challenging people to do just one thing when it seems like an overwhelming thing that we're trying to actually change, I think it's about that. And people gave very good responses to those things, and we've got lots of people signing up to do one thing to actually make a difference, and hopefully that will have the domino effect, and that will motivate people to think, actually this is a big problem, but actually we've got some solutions that are very simple, and we just need to make them work, really. So
it's a case that dementia, once you have a diagnosis, that it's not the end of somebody's life, it's the beginning of a next phase.
Absolutely. It's that part where you have to get used to living differently, and it's like any diagnosis from that point of view, in that whether it's diabetes, which is another area that people don't talk about necessarily, and affects a huge number of people, you adjust your life, and this is no different. And I think that we need to move away from this idea that actually once you've got a diagnosis there's nothing that can happen. There are lots of things that can happen, and it's within everybody's grasp to do that, and that simple things actually make a huge difference to the individual. So some very positive messages, really. So that's good.
Okay, thank you.
That's a pleasure.
Great.